Hey, and welcome to another video where we're going to look at two exercises in particular that show signs of like glute dysfunction, like where maybe the glutes are weak or maybe they're just not firing early enough, or it could be just simply poor coordination of how to control the body. Could even be a weak core, could be all of the above. But at the end of the day, this poor movement represents a lot of lower back and hip discomfort that can end up into real severe chronic pain. So this exercise here that Dylan's showing us is basically a deadlift that we're just doing as a kneeling exercise, and with the band wrapped around his hips to encourage him to use his glutes. So by doing it on the knees, we minimise any potential damage and it's a lot simpler to control. Having said that, the people with issues will find this quite difficult to do. So these first few reps we've seen Dylan do, he's done with pretty good form. Alright, so I'll just take it back and we'll just have a look at a couple of those again, just to break it down for us. So when he comes to there, he doesn't over, this is where we see people who over clench the glutes, sort of push their glutes too far, and they end up like a big banana. Alright, so then they basically take a good exercise and ruin it. So you can see here, his ear, his shoulder, and his hip all are in line. All right, that's the finishing point. So over clenching the glute. So you can even see his glutes at the back there. If he was over clenching it, he would take it too far. He'd take his hips to here and it'd be posterior tilting, which is no good. All right, so firstly, that's the good point. When he comes down, that's the easy part. Obviously, he's just resting here. And we can see that he's got a little bit of a natural lordosis, which is perfectly fine. You're not trying to get rid of it, which so many people are. And later on, we'll have a look at this kyphosis here that he needs to have. Well, it's not even kyphosis, just good shoulder stability, really. But the best part of this movement is when he comes off the ground. All right, so this is when we start to see the issues. So when he comes up, it comes up as one unit. So if I just take that back again, and I'll go even slower for you. So if you see when he comes up, it's all in one unit, and it's really the hips that are driving it forward. It's not his back that's lifting him up. It's his glutes pushing him forward to propel the spine. He doesn't really want to overextend through the lower back. Now, when we see the dysfunction, which is what Dylan will show us on the next one, we start to see where the lower back tries to move first. All right, so you can see that. All right, so I'll just take that back. You can see where his hips have not moved. It's all through his lower back that he's providing all of the extension through his back extensors. He's just going to jam up through the facet joints and right through the SI joint. So he's going to really crank this all up. This is all going to get really tight and nasty. Now, this could be happening because the glutes are inhibited. Maybe they're too weak. Maybe the hips are dominating them so much that they don't have the strength or the ability to actually push him forward anymore. All right, so we may need to work on some other things around it to help that. It could be, like I said earlier, it could be a part of a weakness in the core, so he just doesn't brace very well. So maybe the glutes are there, but his bracing is very, breathing is poor. His understanding of how to combine this as one entity and moving through there. All right, so the hips thrusting forward, but the core staying really strong so he doesn't extend through his back. All right, so this is a great way to learn the bending action with very minimal risk. So if you screw this up and make mistakes, there's no catastrophe from it, where if the standing one with a load, obviously there will be, and there can be a lot of pain from that. This one really overcomes that, and the band really helps that person because they can feel that they have to push the band forward. They have to move in this direction as opposed to trying to snake their way up. So as opposed to trying to lift themselves up, the band is really useful here in helping them to get this exercise just right. And then obviously it leads into the standing one where they have a better understanding of the form that they require to execute it perfectly. All right, so let's look at another exercise where we start to see the similar things happening, but also something going on at the shoulders. All right, so let's look at the second one. All right, so this second exercise is basically the bird dog or horse stance, which whatever you want to call it doesn't really matter. And to make it a little bit more of a challenge, I've added this Bosu to it, which is pretty simple for Dylan. But what we're looking for here, as opposed to the last one, we start to see the shoulder become involved here. Now, the main thing is, again, we want to see that natural neutral position of his spine and his pelvis here. So no matter what happens with this leg extending or flexing, this should not change. It should stay the same. Also up around here, he needs to be pushing up through this arm on the floor. Otherwise, this part of his spine is going to go into extension. Now, if that happens, this sort of disrupts everything down this end. All right, so it all goes terrible because of the poor stability through the shoulder. So this is where you start to see things around here contribute to things on the opposite hip here. Obviously, the main part of this exercise, what it's known for, is the core, but as you can see here, it's really dependent on stability through the hip and shoulder, which is why it's such a great exercise for anyone with low back pain. So Dylan did some really good reps there on those first few. I'll just play them for you again so you can see how there's very little movement through his spine there. He's just maintaining very good core control. He's got good knee flexion when it comes in, so he's all the way there. So he's got good knee flexion and hasn't posterior tilted to get there. So it means he's able to control that in this position. And then when he goes into extension, he's not overextending it. So he hasn't flexed it and he hasn't overextended it. And the whole time this has stayed stable. All right, so let's have a look at what it looks like when you start to mess around. It's not quite as easy to see as the previous one. And Dylan's not used to actually stuffing it up, so he's trying to think how he's going to, the obvious mistakes that we see. And this first pose, he's diving into excessive extension into his lower back there. And you can straight away see that. So there's no core control, and as he's doing it, he's losing his balance considerably. All right, so you can see how the exercise doesn't look anywhere near as comfortable as what it did the first few. It's a bit hard to see here, but he's also showing us what it looks like when you lose the shoulder stability. And I'm just coming in closer. You can see where his top has really sort of creased together because he's trying to create this scapular retraction. All right, so this is where he's losing stability through the serratus anterior to hold this as a nice stable base. All right, so his base of his shoulder is now affecting the whole movement. All right, but also what it's doing, because he's gone into so much extension, his whole body is just excessively extending now, where he needed to have some of the flexion here to be able to maintain a more neutral curvature. All right, so these are great exercises for correcting the problem, and that right there is where Dylan's just corrected it. So if I just take that back, you'll see how he's just used a bit of a protraction of the shoulder just to bring it out of. So there's where he's all horrible, all right, and then as he puts both hands on the ground, he pushes the ground away, and there's his scapula rolling out into here. Now he's got a beautiful stable platform to work from. All right, so great exercises to teach this person how to combine opposite sides of the body, maintaining that perfect core stability with great hip mobility at the same time. So great exercise that you can do many things with, and a great way to test to see where things are going wrong. Like I said earlier, if you do muck them up, it's not going to be horrible pain for you, where other exercises later on will be. This is why we classify this as stability, because you need stability before you can generate the strength. All right. So if you're someone with a lot of pain, these two exercises are great ways to regress your movements at the moment, so you can eventually start progressing to standing things that are going to make a bigger difference, but this time around with better control. All right. So hope you enjoyed that video, and we'll see you on the next one.